Hey, good afternoon, everyone. TJ Ald's I-45 now in Galveston now, along with Dr. Philip Keiser, the CEO of the Galveston County Health District, on with us on what you need to know with Dr. Philip Keiser. Now a bi-weekly show. We're going on every 2 weeks now, talking more than just COVID, although COVID will lead the way for now. But we'll be talking about other health issues going through, including we'll be talking about beach water advisories because it's about to get swimming season now. We're also about making sure you have all your treatments ready to go for you and the like. And some of the new initiatives are going to be coming out of, or long time initiatives coming out of the Galveston County Health District and Coastal Health and Wellness. So we appreciate Dr. Keiser as always being on with us. But as we always do, though, with this show, since we started it now 2 years ago, a little there. One of the things that's been kind of a good news is the fact that Dr. Keiser, that hospitalization rates are at the lowest of all time since those early days of 2020 with COVID-19 in Galveston County. Can you talk about that real quick for us?
Right. That's my big reaction. Yeah. But so what this is that it's, with the Omicron variant that we had in that big surge, we saw our numbers go up extremely rapidly and then fall extremely rapidly. We're not exactly sure why that happened, but we've talked about this and we think that there's sufficient immunity out there in the community between people being vaccinated, whether it's fully vaccinated, partially vaccinated, and or having natural immunity from getting Omicron, that it really slowed things down. So it's a very minority of people in Galveston County that are actually not protected at all against COVID. So that's what we think is going on there. And so with that, what we've seen is the number of new hospitalizations drop, and we've also seen the number of total hospitalizations drop. And so that's because, one, people are not getting hospitalized because we're seeing very few numbers. And but also, unfortunately, it's because there have been people who've died. And, we were stuck at about 20, 30 patients for a while there. And unfortunately, a lot of them had been sick for a very long time. And if you look at our reports that we put out every Friday, you'll see every week there's been a long list of people that have died from COVID. And so hopefully now that our numbers are down really low, we'll have gotten past that. And we'll see how long this takes. We're hopeful that we go for significant periods of time without a lot of COVID.
One of the things you talked about, that long list, just here recently, there was an update on the COVID, and it was catching up on, and it had a large number of deaths just kind of listing out here. We've had to explain this in the past too. There's somewhat of a catch up sometimes.
That's right.
We explain that to folks too, because folks may have seen this kind of long list, like, oh my gosh, what happened? And even though it was within this year, there is kind of a difference, when you see those kind of long lists of when the dates of the death were, what the conditions were, and the like as well.
Right. So we get deaths reported to us from a variety of different sources. And, the primary source is the state. And people may remember, probably over a year ago, the state changed the reporting process. Initially, it was reported to us directly, and we'd report it as a death, and then it would go to the state. And but then they said, no, we don't want to do that. We want to be able to vet those. And so they get reported to the state, and then they come back down to us. So there's some deaths that we know about, and we report them, and we know they happen after we've vetted them. But there are also some that say if someone, maybe a Galveston County resident who may have died in Houston, we only know about that when it gets reported to us to the state. So there is always a reporting lag. And you see that both in deaths, and you can also see that in the number of cases. Sometimes you'll see a single day when there's a whole bunch of cases, and you're going, what the heck is going on here? And when you look into it, what you find is that it's really been a reporting lag, or one lab found 500 cases that they didn't report before, and so it all gets dumped into the system, and it makes the numbers go up precipitously.
One of the things too, though, is we're seeing those numbers come up. We're kind of in those phases. We had the lower number of hospitalizations, and forgive me, we're having some trouble bringing up the graphics on the screen right now. But also too, this is a time now. A lot of focus is folks who are affected with COVID having long-term treatment options and the like. Can you talk about what programs are available for folks they may not know?
Right.
Like UTMB, for example, has a post-COVID treatment program.
Yeah, in fact, most Right, and most major medical centers now have post-COVID treatment programs, and so UTMB's program is run by the pulmonologist because a lot of people have lung problems. But it's not just lung doctors that are there. It's also, they have psychologists and neurologists and other people that can help evaluate people that have long-term COVID. The real problem that we face with this is that we really don't know what we mean when we say long-term COVID. There's a lot of talk about long haulers and what that means, and unfortunately, there's not really good case definitions to it. But so, if you've had COVID and you've been, several months and you're still feeling bad, well, you probably have long COVID. Now, why do you feel bad? Well, sometimes it's because people can be depressed, and remember, COVID does get into the brain and it can change the brain. So that's not surprising. It can be that they could have some problem with their thyroid gland or some of their other what they call endocrine system. It could be that they're having problems breathing because of damage to their lungs, and then there are other things we don't necessarily know about. And so that's why it's important to, if you're having persistent symptoms, to go seek somebody, but also seek somebody who has been following people for a long time. And so, we have a program at UTMB. There's programs at the medical center up in Houston as well that people can go to. We're trying to get a handle with this in the county level as well. And so we're actually going to be sending a survey out to people that have had COVID, where they can fill it out anonymously and tell us about their symptoms. So that way we can try and get a sense of just how big of a problem is this when we look at the total number of people who've been infected in our region.
When you talk about that survey that's going to go out, how is that going to be? Is it going to be mailed, emailed, combination of both?
Yeah,
so
no.
that
So what
folks can kind of know what to expect.
Yeah. So what'll happen is people will get something in the mail saying, "Hey, we know that somebody at your address had COVID, and would you be willing to take this survey online?" And then we also, this is actually being done in conjunction with some researchers at UTMB, and they're actually going to offer them a gift card if they fill it out, because it's a pretty long survey. I've taken it myself, and it takes about 30-40 minutes to fill out, and it asks a lot of questions. People have attributed a lot of things to COVID. We've seen quote unquote increased incidents in domestic violence, increased incidents in psychiatric diseases, increased incidents in lung diseases. And so, it really goes into details like that. How are things going? Are you getting along with your spouse better, worse than it was before? But it's all done anonymously. So that way people can feel safe about it and not feel like that, that they're giving up information, or they're telling people about something that they don't want anybody to know about. And then when it's all done, they can register and get a gift card as an appreciation for doing that. And so what that'll
an incentive to answer the questions then.
Pardon?
And a little bit of an incentive to answer the questions.
Right. It's a little bit of incentive to answer the questions. And like I said, I took it myself. I actually took it twice. And I found myself answering differently both times. So, that's kind of how these things go, right? But the whole point is that what we really want to see is, in people that have had COVID, how bad is it? Are all these reports of long COVID and disturbances, is it a little, is it a lot? And I wouldn't be surprised, it's a lot more than we realize. And then get a sense of, okay, this is what the issues are. So we need to do something, think about what are we going to do about that, and how can we plan for that, and how can we advise our medical partners on ways that they need to be ramping up their treatment programs for folks who have long COVID.
For those of you just joining us, this is our bi-weekly show now, what you need to know with Dr. Philip Keiser. And while we're talking about COVID now, we're going to be getting to some other subjects here in a little bit. And we talked about, for long haulers, now let's talk about the new variant identified yesterday, COVID-19 XE variant. What should people know about this? Obviously it's one of those things of, every time we hear about a new variant, there's always kind of that ratchet up concern from health officials. But from your perspective, what should folks know right now?
Well, my gut reaction is to get like a little tightness in my chest, thinking, "Oh my God, I hope this isn't here we go again." So we've been through Groundhog Day so many times with this, another new variant, And the answer is we just don't know at this point. From what we know about this is what's called a recombinant variant. So it's part of the BA1 variant and the BA2 variant, which both are variants of the Omicron. And there have been over 600 cases identified in the UK. There have been a couple places that have started to monitor for it in the United States. They haven't found it in the US yet. But, this is the sort of thing that I've been really concerned about because what we saw with the Alpha variant and the Delta variant, and now the Omicron variant, at least the Omicron 1, is that, the numbers come up and then they go down. And what really catches us is when we have this big shift. And so I don't know yet whether this new variant represents something that's very different and represents a threat, or whether this is just more of the same of what we already have with Omicron. And I think time will tell with that.
And then we're seeing news come out of China here that they're going through cases and just like it's running rampant again.
Yeah.
And maybe some of it's population based. You said something in our last time we spoke about this, is that actually vaccination rates in China are actually rather low. There's kind of this concern there. So these lockdowns that are taking place, and people seeing those in the news. Why are we seeing COVID-19 kind of run rampant in China, but not seeing it elsewhere at kind of the same numbers? I mean, we're seeing like an uptick in some areas, but not what we're seeing over in China right now. Is it a population thing, lack of vaccination, combination of both? Just a better healthcare system elsewhere? What would you say?
The primary thing is the Chinese took a different tactic, right? And their tactic from day one was to lock down. And when I say lockdown, I don't mean like we locked down in the United States. I mean, they tore up streets going into Wuhan so people couldn't get in and out. They tracked people on their cell phones. They organized places by block. And if you had COVID and people knew about it, your neighbors would come and make you go back inside. And so what happened was they didn't really post except for Wuhan initially, they didn't really post the very high numbers. And it was done by control, right? For very, 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 very tight control, a level of control that Americans would never stand for. So what that meant was that not a lot of people got exposed. And then when they rolled out their vaccine, not that many people wanted the vaccine. And then quite frankly, their vaccine was not that good. And unlike the vaccines that developed in the United States, and then of course the Oxford vaccine was just pretty good, and the Russians actually have a very good vaccine, but none of the Russians are taking it either. And so there's that vaccine hesitancy all over the world. And so when you add it all up together, now you have Omicron, which is about twice as infectious as the Alpha variant, the first one that we saw. There's no stopping it. And just locking people down isn't enough to stop it. You really need to have that immunity, and the immunity that you get from vaccination and or from prior infection.
One of the things that, we talk about vaccinations rates and the light as a comparison here. And I'm going to try this. I think we may have the situation I had on the screen because I was going to bring this up earlier, but wanted to see if we can get it to come. It's not going to come up now, but one of the things I wanted to remark on, and we'll just talk about what I'm looking at on the graphic side here, that I'm unfortunately can't bring it up, is that in Galveston County, ages 5 plus, I should say, are fully vaccinated. 63, almost 64%
right
there. Right. How does that compare to elsewhere? Because
it's about
Galveston County has been kind of pushing this.
It's about average when you look all over the country, and there are spots where they're much better, and there are spots where they're much worse. So we're kind of at the average in terms of fully vaccinated individuals, and we're at about average in terms of where we are in the state of Texas. We had very good success very early on a year ago, and we're actually ahead of the curve. But like many places, we ran into a lot of vaccine hesitancy, and that people just didn't want to get vaccinated. So, it was the beginning of April, we realized that, we had gone through all of the people that really, really wanted the vaccine, and that the next group was going to be very, very difficult to do. So, to me, the big concern isn't so much that number. It's just that we are behind the curve in terms of getting people boosted. And so we have a lot of people who haven't gotten their first booster, and even more people who haven't gotten a second booster. And so, we're really encouraging folks, look, you've already been vaccinated. Just go ahead, and it's time to get your next shot, whether it's your third shot or if you're over 50 with your fourth shot, just go ahead and do it. The people who have had all three are very unlikely to get in the hospital. People that have had all four, almost never happens. So, we think this is a very important thing to do.
Took at the numbers there. This is the graphic we were trying to bring up earlier for you. And by the way, also encouraging is the total number of active COVID-19 cases
Look at
now
that.
701 are
Yeah.
really down from what we saw not too long ago, in fact,
Right.
there. But again, looking at residents ages 5+ with at least one dose, and it's 70.67%, that number there. But as you said, it's that second dose, the third, or now we're calling the fourth,
Right.
as well, which just opened up here recently as well to
Right.
folks. But how does this compare then to flu, pneumonia, other vaccines that are out there?
Much better.
Right.
I wish we could get numbers like this with flu. And the other thing is that the vaccine's much better than the flu vaccine. If we get 45-50% of the people get vaccinated against flu, we're doing really, really well. And if we have a flu vaccine that has like a 50% efficacy, we're doing really, really well. So, you
Right.
do like 50% times 50%, that's about 25% of the people who get a good response. And with COVID vaccines, we're looking at 90% of people that are fully vaccinated. So it's a really, really good vaccine.
And as you see the rates there, folks, that will tell you of that higher rate than you would see in some areas, and is effective. Let me talk about this one. We talked about China and lockdowns and the like. A lot of folks, when you say CDC, will look at CDC and say, "Oh my goodness, they're worse than communist China." At times. There was an announcement that just came out last week that the CDC is going to reevaluate. Actually, starts April 11th. Actually, they're bringing in someone specifically. And you have at times been not at times, often, I should point out, have questioned some of the CDC recommendations and
Sure.
whether they've been too slow, too fast, mostly too slow on things.
Right.
And also kind of taken, kind of cookie cutter measures for the entire country type approach. And I know that's a national perspective versus local perspective.
Yeah.
But what do you think of this? Because it's in the wake of COVID-19, where a lot of processes that were kind of in place were found to be outdated.
Right.
And we're talking about processes, not maybe the science so much, but the processes used. Where do you see that as someone in public health and someone who heads the largest public health institution in Galveston County? Where do you see about this evaluation, and what if the leader of CDC would listen to you? What would you recommend that they do?
Okay, well, good. We can throw a lot of stones if we want to, but we've also made mistakes here in Galveston County. I think early on, one of the mistakes that the CDC made was trying to control things too much, right? And didn't necessarily listen and provide for testing that could have been available. That rollout of testing was not good, and it slowed things down quite a bit. But overall, I think what CDC is going to be looking at is not only their own processes, but things across the country. And I think there's some very clear things. Number one is that public health authorities and officials and organizations were slow off the mark in terms of responding to COVID. I think the second thing is that there was a real problem in public health messaging, right? And I can't tell you early on how many times I heard, well, based on what we know about this virus, and we didn't know anything about this virus, and I would sit there in meetings and just cringe well, based on what we know about other viruses, this one will behave this way. I'm like, you don't know that, and you shouldn't be telling people that. I think one of the big mistakes, again, made early on was that, we don't want to panic people. And it turns out that, people didn't panic. People wanted to know what's the risk, what's the real risk, what do I have to worry about? And I think if you're honest and open with people and tell people what their real risk is, then they're much more likely to believe you. And so some people saw through that added to the distrust. I think that there clearly was a problem with the information technology that we use to track this epidemic. We had to develop our own. It didn't exist. There were some efforts to do sort of a statewide thing, and when we talked to them about it, they wanted us to give all our information to them, and we said, fine. So you're going to give this back to us, right? And they go, well, we're not sure. And I was like, oh, no, sorry, that's a deal breaker. And so we developed our own, and we're not the only place that did that. A lot of places had to develop their own information technology. Like I said, public health messaging, getting clear, consistent messages, but also a little bit of humility when you get it wrong. And that's something I think that we saw a real paucity of. And, like when the message went out and the message was wrong, and people would say, well, wait a minute, you told us this and now you're telling us that. And it's like, well, that's because now we know, and it's all kind of comes across as being, condescending and a little bit, like I know more than you, and you should just take my word for it, as opposed to saying, yeah, we made a mistake. Okay, we got that wrong. That was a mistake. We shouldn't have said that, and we know better now, based on the fact that we made that mistake, and we need to get things better. I think in terms of things that one of the big things was the whole issue of masking. That was a debacle from the beginning to end. You don't need a mask, you need a mask. You don't need a mask, you need a mask. Everybody needs to wear a mask. Everybody needs to wear a mask all the time. You need to wear a mask in your car. I mean, you'd see people driving down the road in the car by themselves wearing a mask, right? And then once a certain number of people got vaccinated, the CDC said, oh, people who have been fully vaccinated don't need to wear masks. Well, that may have been true, right? But that was a terrible message. Why? Because it got interpreted as nobody needs to wear masks anymore. What happened? Nobody need to wear. No, people stopped wearing masks. You can almost date it. And then 2 weeks later, boom, Delta surge, just like that, bam. So I think that was, again, a big mistake in messaging. From a public health point of view, the thing that I found the most frustrating from the CDC's point of view and the public health is that they would give guidelines, but they wouldn't tell us the data behind it. All right. And, and some of that has to do with, we have to do the peer review process, and we have to let other people vet it. And really, what they really needed to do was say, okay, here's the recommendation. Here's the data. Here's why we're making this recommendation. So early on, when CDC would make these recommendations, I would think, oh, well, they have data. I'm sure, they know what they're doing. And then later on, I got a little more skeptical about it. I'd really like to see that data. Things that I think they've done well, I think, the rollout of the vaccine went about as well as it could. I mean, think about it. Look at how many people got vaccinated within just a few short months. And so that was something I think that really went extremely well. In terms of some of the therapeutics, there were, with the antibodies in particular, I thought they did a good job of not only rolling those out, but also giving us the information that we needed on our end to say, okay, we need to switch from this monoclonal antibody to that monoclonal antibody because the mix is changing of the virus, and we need to make sure that we use the right one. I'm hopeful that at the end of the day that CDC will not only look at their own internal processes, but actually look toward a national strategy, and then be able to come back with recommendations for Congress to fund things. This is a big wake-up call for America, and I'm hopeful this is like a World War II wake-up call was for the national defense, and that we'll fund public health. We'll be able to have the workforce that we need, so we can be out in the community addressing diabetes and hypertension and drug use and exposure to toxins and all sorts of things that are out there every day, and have all of the equipment we need, and have all of the IT that we need, and all the expertise that we need, so that when another pandemic comes, we can go, okay, guys, it's here, let's pivot. And it's not an issue of, oh my God, how are we going to handle this? It'll be an issue of, we've got it, we've done this before, we have the tools that we need, we can do this. So that's where I kind of think things are right now.
And I should point out to anyone who's watching this, who may be saying, finally, actually, I should point out that you have not been shy about criticizing when the CDC has made recommendations through the year. Everything you've just went down that bullet point list on, I'm telling you, we can go back to shows and find where you've said the same exact thing.
Okay.
Times before. Because I've noted it every single time that it's happened here along the way. Before we get off the subject of COVID here, we did have a few questions from some of our viewers when we were talking about vaccinations earlier. This one's a pretty softball one. What does fully vaccinated mean in this context? Is it the second plus a booster or more than that? And so what is considered fully vaccinated then?
Yeah. So if you're under 50, it's 2+1. And if you're over 50, it's 3+1. So if you've only gotten 2, you should be getting another one. Okay. Let's just make that real simple.
Right.
And if you're over 50 and you haven't gotten your 4th one, you should go back and say, has it been 4 months? I'll bet you it has. Since you've gotten your 3rd one. And if you haven't ever gotten a 3rd one, just go ahead and get the 3rd one.
And then Regina Haley is asked one about the efficiency of the second booster, but then asked this: should I wait on getting the second booster since cases are so low right now? Yeah. And that's a question I have though too, is that if you've had a booster and you haven't had that second booster, then is there a waning effect, and does it kind of work with the booster before, or can it wait? Does it have to be done in an amount of time? I actually had someone ask me this question the other day.
Right. So what we know about the 4th shot, there is the law of diminishing returns, right? The 2 is clearly much better than 1. You really do need 2, or if you've had COVID, at least 1. You need 2 hits, okay, to do that. To get the type of protection you need, and then the 3rd one brings you back up almost to where you were before. And the 4th one brings you up a little bit more than from what you've lost. But it's not like getting that first shot. The good news is, and I, as someone who's had 4 shots, I can tell you this, is that first shot made me sore. Second shot felt terrible.
Yeah.
Third shot, arm was sore, waiting for the other shoe to drop, but a little bit of Tylenol, and I was okay. 4th shot, nothing. Okay. So that tells you a couple things. So people are afraid of getting that shot because it's going to make them feel bad. You don't have to worry about that. But it also goes to the point that you've already got that immunity, so it's only giving you a little bit of a boost. I would go ahead and get the second booster now, simply because we don't know what's coming down the line, right? And if I could reliably say, the only thing that's going to come is it'd be Omicron too, then okay, fine, maybe okay to wait, but we don't know that. And if something bad does come, it would be best to have the highest levels that you can, and that would be with a 4th shot.
Regina, thanks for your question. And in fact, Dr. Keiser actually answered your other question that popped up when we were talking. What's the data on that? And he pointed that out there, plus gave you a little bit there. So they're good information for you to consider and go along. And if you have your questions, you can go ahead and ask those of us. We're going to move on from COVID-19 now, though, however, and start talking about some other health issues going along. And one of those is that the Galveston County Health District recently got a grant from Blue Cross Blue Shield. I don't know why I had problems saying that here. That's going to be part of its HEAL project, with this healthy eating, active living out there. Talk about that in this initiative. This is an ongoing initiative by the Galveston County Health District of just the overall health in there that includes, eating well, diabetes prevention, and the like as well. Talk about that and how this grant, I should say, from Blue Cross Blue Shield is going to help out.
Right. So basically, it's if you take away COVID, what are our biggest issues? Our biggest issues are diabetes, hypertension, obesity, and all of the side effects that come from that. And the way really to have people meaningfully impact that is to change the way that they live and they eat. All right. And I like to eat. And I've struggled with my weight all my adult life, and it goes up and down. And I suspect a lot of people like me out there. And but the most successful way is to change your lifestyle. That is, don't go on a big diet, but gradually change things. Eat the kind of foods that you like, but that are more healthful for you. So, avoiding eating lots of red meat. I love steak and a glass of red wine. But don't do that every day. Don't do that. Only do that on a rare occasion. Eat more fresh fruits and vegetables. And these are some of the things that you're bringing up that are really kind of go into that. So we publish recipes. We have links for people where they can go and learn about how to cook better. And then the other part of that is the quote unquote active living. So get active. Start doing everything. Go for a walk. That is probably one of the most important things. The difference between the most important health benefit you can get is by getting off the couch and going for a walk around the block. All right. Okay. And then everything you add to that gives you a benefit. But again, it's diminishing returns, so like, okay, now I can do 5 miles. Well, guess what? That 4th mile to the 5th mile doesn't add that whole heck of a lot more. And that 5th mile to doing a marathon doesn't add a whole heck of a lot more. You've heard about 10,000 steps. So, there's been some new research out now that really is that says you really don't need 10,000 steps. You probably 6,000 or 7,000 steps a day is really the optimal amount. So, so it's not a huge amount. So the HEAL initiative is a way that people can go to get some resources and see what the recommendations are and try and figure out, okay, how do I incorporate this into my lifestyle? Or how do I change my lifestyle so I can incorporate these recommendations in so I can have lasting change? And that's the real key to this program. So, we're going to be promoting this more and more, as we get out in the community, as we've started to do, with COVID mitigation. We want to keep doing this, and we want to do this on things like this, and we want to do things on like screening for diseases like diabetes and hypertension, and then referring people to doctors, but also helping them connect with people that can help them make changes in their lifestyle so they can live better.
And if you go to the Galveston County Health District website, gchd.org, that page you see me going into there is under their public health services section. It's called HEAL homepage, HEAL homepage, and you can see all that information that Dr. Keiser was talking about, including an active living events calendar that will input events going on. So, by the way, if you have an event like that's going to make people walk, get healthy and stuff, send it in.
Oh, absolutely.
On the calendar. And,
absolutely. And every year we promote the Texas Challenge, which is the different cities you sign up and different cities compete against each other, where you put in how much you exercise and you get points, and Texas City always seems to win. I don't know why, but
they've been active in that from day one. Now they got Mayor Dedrick Johnson's a lot healthier than the rest of the council, so I think he's going to really in there. I think he's challenged him to races and stuff. He's out there playing. We did a story with him recently. He was playing ping pong like every Friday, and it's not your normal kind of ping pong. It's like serious stuff.
It's killer ping pong.
Yeah, it is. It is like something you see in the Olympics going on.
Cool.
As well. We have a question from a viewer here that is going to tie into exactly what we're going to ask about next, which is, what about your indigent program? And I need to get some stuff done to my legs so I don't lose them. And that's a little more detailed there, but that was going to be our next subject to be talking about. In fact, is about with coastal health and wellness for folks to understand that you can go in and get care, and you can sign up as a patient, taking patients now. Coastal Health Wellness, while it's not part of the health district per se, there's a lot that they work together on that. So talk about that, how folks can sign up and get care that they need, because it's not just, hey, go in, wait in line, and we're just going to give you basic care, move on. If you need something more advanced, Benny, they'll be able to help you out and get you hospital care. Tertiary care is the term used inside sometimes as well.
Right. So the every county under Texas state law is required to have what's called an indigent care program for people who are really just destitute and have no way of accessing health care. And Galveston County has one, and people I see the question is really referring to some issues that have been in the news where there's been I don't want to say debate. There's been actually big disagreement about the way that the county indigent program was run, and a third party that the county had contracted with, and they basically parted ways. And the judge's office asked the health department if we would take over that managing that program, and so we are, and that started April 1st. But basically, for people that have no funding whatsoever, they can come and register for that program, and we can get them access to specialists and whoever they need. Generally, the way Coastal Health and Wellness works is that if you need care, you come in, you have to do a financial evaluation. Nothing's for free. Basically then people are asked to pay based on a sliding scale on what they can afford. And then we're able to provide care for them under that. And, we provide medical care and dental care and counseling services. We have some pharmacy services. We just came from a meeting where we're actually talking about bringing a pharmacy in-house and adding more and more services. So, we think the clinic's on the up and up. We've just made some offers to 2 new doctors who have agreed to come, and so we're really planning on expanding the services and just improving the care. So anybody who doesn't know where to go or doesn't have a place to go, they can come to Coastal, and we'll take care of them.
We should point out too is that sliding scale. If you have insurance, and maybe it's not a Cadillac plan or full insurance, that's also you can come over there.
Yeah.
It's not just I pointed out because I have referred people there. He says, "Well, I have insurance. It's just not that good." I said, "Well, then go to Coastal Health."
Well, then that's right. We want you, and the other places don't. Okay.
Yeah. And I'm like, go there because they have counselors on. That's the thing. Coastal Health Wellness has counselors on staff.
Right.
Who will go through and help you get signed up for what benefits you're due.
That's exactly right.
To help you out there. So I think that's something that's met. And Benny, we hope you can get in there on that. Hopefully someone, you just, give them a call. They can, as you can see on the site there, and they can help you out. Even if you just call the health district, they can forward your call over there.
Mm-hmm.
But Coastal Health and Wellness, Benny, is where you need to go. And we'll put a link up to you so you can get it there. I know it's a little more, you probably like to call instead, but do that so you can have an opportunity to take care of that, because it also provides dental care and, as I said, counseling services that are there to help you on that healthcare journey you may have. And as I said, I've referred people there who have no insurance, people who have maybe a little bit of insurance.
Right.
And if you have no insurance and you go in, they can also get you signed up for Medicaid or Medicare if you just found the bureaucracy too much. Do be patient. I do warn everyone on this type of setup. You do need to have patience. It's not a walk in, get it done in 5 minutes. Things take time. Mm-hmm. It's going to take time, but it's worth it. And we're going to be doing a follow-up on that now, since the Coastal Health and Wellness is kind of we didn't want to hit them right off the bat of April 1st, because that was going to be the first day and knew that the phones were going to ring off the hook. But now we want to be able to do that to provide more information to folks along the way. But like you said, 2 new doctors coming in, a new CEO for Coastal Health and Wellness as well. And after not too long ago, some major troubles with how they ran things over there, and it's cleaned up its act considerably since that time as well. So that's a good thing to know about as well. Again, not necessarily for humans here on this, but we've got a couple of low-cost pet vaccination clinics coming up April 21st and 22nd at ARC, which, by the way, a lot of people don't realize that the Galveston County Animal Resource Center, which handles the animal control for Texas City, Lamarck, several other cities in the county, in the mid part of the county, unincorporated parts of the county. It's located. The offices are located there in Texas City, but has on regular basis these low cost vaccination clinics that they have. Those are coming up April 21st and 22nd, and you don't need to even make an appointment. Just go and no matter what city you're in either. Too, you don't have to be in what would be for example, Santa Fe and Dickinson have their own animal shelter in Dickinson, but it doesn't matter if you live in those areas too. If you need to save some money on your pet vaccinations, you can come on over for this.
Come on. Or if you're looking for a pet, come on over. We have adoptions and both of cats and dogs. And, there will be times that we have reduced adoption fees and a lot of things thrown in to induce people to come. So, we had an employee who was moving on, got another job, and he went over to say goodbye to the folks over at the Animal Resource Center, and he left with a dog. He didn't intend to, but so because once you come and take a look.
Yeah,
you're going to find something that's hard to turn down.
that's for sure. And you can adopt a pet there too as
Yep.
well. And that's also low cost there. But you see the number there and you see the address of those clinics happening 21st and 22nd. We'll have some more details on that coming out for our viewers as well, so you can keep up with that. Now it comes to another kind of thing that you all have to deal with on all the time. We're getting close to that season where everyone's going to be hitting the Gulf. We had spring break. Weather wasn't the most cooperative in the world, but now we're going to see folks, as it heats up, folks heading out on the water. We're going to see it mainly the Houston TV stations be covering it, saying, "Oh, there's a beach warning for Galveston."
Right.
And that'll include, by the way, Texas City and the like as well. I just wonder if we, if you can kind of explain to folks,
sure,
what exactly when we see beach water advisories. And what does that really mean? For folks.
So we're part of a federal program called Beach Watch, and we have stations all along the beach where twice a week someone will go, and you may see Galveston County Health District truck, white truck with a logo on it on the beach, and they're collecting water samples. And what those samples do is they test for a bacterium known as Enterococcus. And Enterococcus is a bacterium that is associated with stool. Okay, now people aren't going to like this because this sounds gross, but basically it doesn't mean that there's sewage in the water. But what happens is that, like, during a time of heavy rains, a lot of runoff from the farms gets into the bay and gets into the Gulf, and so we measure that by measuring the amount of Enterococcus in there. So when you see the numbers go up, what that means is that a particular station has measured a higher level than normal. All right. And then it's meant mainly as an advisory. It's up to you. My advice would be, if you see a spot and you go to the website and you see a spot and it looks red, go on down the beach to where a place is green, right? And all that means is then that one particular area that they found some of this Enterococcus there. For the most part, Enterococcus can cause a diarrheal illness, so make people sick to their stomach. But we do want to warn people that are more susceptible. So again, people with liver disease, people with diabetes, people don't go in the water with open cuts, because that's when we start to see people really get into trouble. There's another infection called Vibrio vulnificus. This is the flesh-eating bacteria, and we get 4 or 5 cases every year. And typically it occurs in people that, they may be out fishing on a jetty and cut their foot and get salt water in, or out on a boat and cut something and get water in, or just go in the water with a cut on, and they can get a bacterial infection. And again, that is the skin gets very red, and it can sometimes progress to be a life-threatening infection, particularly if you're older and you have diabetes or you have liver disease. So, we would warn people, if you're susceptible to having a bad outcome, don't go in the water when you have open cuts, and that's regardless of whether the levels are high for Beach Watch. So the way you use the Beach Watch data is, if you see red, don't go in the water there. You're not going to see red all up and down the beach. You'll find one spot here, one spot there, and there's hundreds of spots. So pick a spot where it looks good, and you should be okay.
And it's somewhat, no, it is somewhat. I should point out, or should ask you this question, I should say, is that it is somewhat isolated in that this beach may have it, but a mile down the road or half a mile down the road, it doesn't have the same warning.
That's exactly right. And it's pretty typical, actually. And so usually it's all green. Every now and then you'll see a yellow, and every now and then you'll see a red. And usually those are isolated or 1 or 2 spots. And so the whole point is so that the public can be aware of these spots is probably not the safest place to go, and that they should go somewhere else.
Right. And then and then it's actually, when you click through and you're taking, I'm going to hopefully bring up the map here in just a second here. Mm-hmm. When you go onto the Galveston County Health District website to get this information, you're actually going to click through when you want to see where the warnings are, and like you're going to click through, and it's going to take you through something that's maintained by the General Land Office here. It's called TexasBeachWatch.com, and this will give you kind of a different perspective where you can see, like you said, you see the greens all along here, and then you see a couple of yellows popping in as well. You can zoom in on your particular area that you're planning on going.
But just look at that and see, and you can see where the yellows are. There's one up like about Sabine Pass. There's one south of Galveston, and then there's one even farther south around Corpus Christi area. And so, other than that, the beaches look good. But after heavy rains, that's really the time to check to see when if the colors are changing, because that's when we see a lot of runoff, and that's when we see the numbers go up. Now, from a public health point of view, this thing has two purposes, right? So the number one purpose is to allow the public to say, hey, I'm going to go here and not there. But the other thing is let's say we see a spot that's red a couple times, right, in a row. That tells us there's a problem there, and we need to investigate and see what's going on. Maybe there's some sewage that's leaking in, or a pipe that's broken, or something that has to be addressed and fixed.
There's a runoff from somewhere.
Yep, that's exactly right. And it's not just a one-off thing. There's something serious going on.
All right, so as I said, this is going to get hyped up a lot over the summer. We know, particularly as the warmer temperatures kick in, and it's supposed to be a warmer summer than normal. And when the waters get hot, these, like you said, after a rain off, we're going to start seeing more folks down the beaches, but these alerts coming out as well. So we appreciate you as always, Dr. Keiser, coming on with us again, folks. We're going to go to a bi-weekly schedule now, so every other week. So we'll be back in a couple of weeks here with Dr. Keiser on Tuesdays at around 2:30 or so. We'll come on, not exact because our schedules, he and I are sometimes down the hall trying to get into our offices to do the show. And it's not as easy sometimes as we plan out. But if you have a subject you want to cover, we do appreciate Benny, for example, ask about the indigent healthcare program, which we're going to be doing more with the health district on as well to help get those out. But if you have any questions to us, you can feel free to send it here to us at I-45 Now. Be more to glad pass those along when we meet again in 2 weeks. Dr. Keiser, thanks for coming on with us. Appreciate it.
Thank you for having me. Good to see you again.
All right. Thanks for watching. You've been watching What You Need to Know with Dr. Philip Keiser here on I-45 Now and Galveston Now.